Good morning and welcome to Eyefinity Learning training webinar series. My name is Tina Sanchez and I will be presenting Understanding the Patient Portal Experience today. Thank you for joining and we're going to jump in and get started. So let me go ahead and I'm going to bring over my EHR here. So first of all, if some of you guys are not familiar with the patient portal, what the patient portal is a secure login location for your patients that they can use to update their medical history. They can review finalized visit notes. They can exchange intramail with your staff at the office, whether you be, an optician or whether you be a technician or a doctor. If you have it set up, you guys can, share intramails back and forth between your office and the patient. Also, they have the ability to view their final contact lenses or eyeglass lens prescriptions on the website as well. And as you guys probably know, you have that, and there's that FTC rule now that you have to give that patient a copy of their prescription, whether they be in the office or whether you send it to the portal. If it's on the portal and that patient has availability to go on that portal and pull that prescription up, that meets that FTC rule. So we're going to first jump into the firm admin side of EHR because we're going to talk about some things that you can kind of control what's happening, on the portal, what the patient can do and what they can see on the portal. So I'm going to go ahead and log into my firm admin account. Whoop, I need to put in the right password. Maybe. Give me 1 second. There we go. All right, so first I'm going to scroll down here onto the left-hand side. So I'm going to just scroll down and I'm going to go down to the area where I can manage like my manage things that are happening in my portal. So you have this area right here that says manage patient portal features. So you can see you have options here. So first of all, you have this manage appointment request. So if you want your patients to be able to send an appointment request to your office from the portal, then you can go into here and set this up. So I'm going to click on this. And you can see enable appointment request for the practice, yes or no. So if I wanted them to be able to send an appointment request to my office, through that intramail functionality, then I could say yes here so that they can send me a message to say, hey, I need to schedule an appointment. But, your office may have online scheduling already. So you may be like, yeah, no, we don't really want them to send us messages, like this to schedule appointments. But if you want them to, then toggle this to the yes answer. So I'm going to click back on practice settings here so I can go back to that previous screen. Now it does take me back to the top, so I have to go back down here to my manage portal, patient portal features. Next is your manage refill request. So if I click on that, same thing here. If you want to enable them to send you a refill request, to the practice, then you can, say yes here as well. If you don't want that feature turned on for the patients in the portal, you can leave that as no. So I'm going to go back to practice settings again, scroll back down. Next is our manage intramail settings. So I've mentioned intramail a few times already here. That's if you want the patients to be able to send you messages to your practice. You can also respond back to them via intramail, from your practice to them. And if I click on manage intramail settings, then would you like to receive patient updates in one summary intramail per day? So if the patient's doing multiple, I guess, updates in here, whatever, then you can say, yeah, I want it to be in one summary intermail per day, if they're sending multiple intermails at the same time. Visibility of staff groups in the web patient portal. So show staff groups based on locations where the patient has been seen, or show all intermail enabled staff groups. So we're going to talk about this a little bit more in a little bit. When we're talking about staff groups, you can set up groups that are receiving these messages that are coming from the portal. And, if you have multiple locations, you can see that you can set it to send to those staff groups based on where the patient was seen previously, instead of just sending it to an office that they've not been to. Okay. All right. So I'm going to go back to practice settings and then go back down here. Next is this app patient settings, display upcoming, so this is appointments. So display upcoming appointments for the patient. So if in their portal, if you want them to see what appointments they have scheduled upcoming. Now you may be an office that, sends the appointment reminders. Maybe you're using our electronic notification system, and they're already getting those appointment reminders, but you also want them to be able to see in their portal, if they have any upcoming appointments, then you can say yes here, and they will see those appointments also on their portal. Okay, so I'm going to go back to practice settings. Then I'm going to go back down. Auto enable patient portal. So generally, you can go in and enable the portal for a patient one at a time. You may have patients is like, yeah, I don't want to use the portal, or you may be like, well, my patient demographic is, most of them are probably going to want to use the portal. So you can come into here and basically auto enable the patient portal. It's just a yes or no here if you want to auto enable the portal once you create a visit. So you can see where it says auto enable portal upon visit creation. So if it's a brand new patient and then when you go and create a visit the first time they're in, that's going to auto enable the portal. I'm going to talk about that in a little bit, how you enable the portal or activate the portal within a patient's chart. But if you have this turned on, then it's going to auto do, what we're going to cover today, the manual process. All right, so I'm going to go back to practice settings, go back down, and then manage optical RX settings. So this is the last portal feature that you can manage here. So show patient's glasses and contact lens prescription in the patient portal. So if you want to give access to that patient to be able to print their prescription out of the portal or even just view it in the portal, you'll turn this on as yes, so then they can see those prescriptions. It's entirely up to you, but like I said, if it meets that FTC rule that you are required to give them a copy of that prescription when they have access to it in the portal. Okay, so I'm going to go back to practice settings. All right, so the next area I'm going to talk about is, let me find it here, the staff groups. So we talked about down here, one of the features is the intramail. So that's when you want to manage your staff groups. So if you want to use the intramail functionality in the system and you're like, well, how do I set up, some sort of group or something to receive those messages? Maybe the doctors don't want to receive all these messages. Maybe they want to just set up a group of their technicians or to receive particular messages when it comes to questions about EHR. Maybe they want to set up a group if it, comes to questions if you're using our practice management. But definitely you can set up these groups here in the EHR side and click on Manage Staff Groups. Now you can see I have a couple of groups already created. So patient portal refill requests. So we talked about that the patient can submit a refill request to you via the portal. So you can have a staff group for that if that's something you're gonna, utilize in the system. Patient portal visit requests. So that means, if they're requesting an appointment. If you're allowing them to, do that, then you can set up these different groups. Now, you also can assign staff members to these groups. So because I have them created already, I'm going to click on modify, and you can see here that I have group members already assigned here, but if I click on the drop down, I can see all my staff members here, all my doctors here. So if I said, oh, you know what, I want Tina to receive all these messages for the visit request, because maybe she works in up at the front and she schedules appointments and I want her to get those. Then I can assign her into this group and she'll receive those messages. Now, keep in mind, these messages are going to be in EHR. So she would have to have access to EHR, to see these messages. And the staff member has to be set up in your firm admin as a staff member or a doctor for them to be on this list. If they're only in the practice management side, then of course they're not going to be on this list. But yeah, you can easily assign people here directly to these groups. Now, if you want to create a new one, you can go up here to the top, click on new group, and you can name it. You can assign staff members, locations. See, I have two offices. So I can say, yeah, I only want this group message to go to Ocean Vision or Surfside Optical if you have multiple locations. So very easy to set up. And you can see right here, is group available for patients to intramail? So if you want the patients to be able to intramail you, you would check this off as well. Okay, I'm going to cancel out of this. And you can see right here, this says available to patients. Mine says no, but if I wanted to make this available to patients, I'm going to modify, and then I would come here and check that off. But you'd want to check that off because you can see it doesn't allow me to modify it. Let me see if it'll yeah. So you want to make sure that's checked off when you create it. All right, so that's your staff groups that you can set up. Now, keep in mind, all this that I'm going over, if you have questions about it, remember your help menu. You can go up to your help menu, look up the patient portal. It gives you information about all of this setup that we've talked about so far. All right, so I'm going to cancel out of here. And then the last thing here in the firm admin is, let's talk about the sections that the patient will see, on the patient portal when they log in. So I'm going to go down here and we're going to go to this area. You see patient clipboard, kiosk, and portal settings. So this controls, all three of these things. So I'm going to click on manage sections. So first is your your kiosk section. So this is just specifically kiosk if you're using that. But let me go down to past medical history. And if you look on the right, you see where it says clipboard and portal here versus kiosk. So this is where you can kind of set, what is on the portal, what's on your clipboard, in your office. But you can see these have locks here, but you can see how these things are checked off. So if I'm looking in my firm admin in my office and I say, you know what, I don't want some of these things to be on on the clipboard and the key and the portal, because this affects both. You don't have an option to say, okay, I want it for the clipboard, but I don't want it on the portal. It is the same for both. So if you check off anything here, it's not going to show on the clipboard. It's not going to show on the portal as well. Same thing with surgeries. So you can update those. Same thing with ocular history. You can uncheck things here or update them if you don't want them to be on that portal. And then let's go to social history. Same thing here. Right now, we're not showing sexual activity on our portal. Maybe we don't care to know about exercise, or we don't care, to know about caffeine usage. It's up to you. You can, set this however you want to. You can see smoking habits, alcohol and drug use, and then other is locked down, so you cannot change those. But you do have, some capability here to customize, what is happening on the clipboard and portal combined. Okay, So I'm gonna go out of this. So that's the firm admin side. Now I'm gonna go ahead and log out of my firm admin, and I'm gonna log into EHR as myself. All right, so I'm gonna look up my patient, my Rachel Ray patient today. So you look up your patient. Like I said, if you have it set as auto enable the portal, when you create a visit, it's going to auto enable that key and that portal. But if you don't have that set up, then when you open up a patient's chart and you want to basically activate the portal for them, you're going to go up here in the patient's header, and you can see where it says patient portal here. Mine says active already because I already activated this one, but generally you guys are going to see the word inactive here if you have not activated the portal yet for the patient. So I'm going to go ahead and click on this active just to show you what it looks like. Now here it says this patient has the portal enabled. You can send them an email with steps to access their portal by clicking the send button. So even after you set it up the first time, you activate it the first time, if the patient says, hey, I didn't see, the email, and or maybe I waited too long to activate it, then you can always resend it to them. So what happens when you click on the inactive link up there? It basically will, you know what? I'm going to do something real quick just to show you. Let me see. Let me see if I have. I don't think we have. Okay, here. Going to see if one of these patients, yeah, you can see right here where it says inactive, just to show you this one real quick. So if you notice, it asks us for an email and a username, and it tells us the patient will receive an email with instructions on how to set their own password. The email link will expire in 72 hours. If the link has expired, they can use the forgot password link on the login page. So you will fill in this info. Now, if you're using our practice management side for an Encompass, then if the email address is documented on the patient's demographics page, when you go to activate this, their email and username is going to populate with that email address. So it will auto default to that. Now you can change it if you say to the patient, hey, I got your email address is this, and they're like, oh no, can you send it to this different email address? You can update this info even though it auto populates. And maybe they don't want their username to be their entire email address. Maybe they just want it to be their first initial and last name. Then you can also update this. And once you put in info here, you're going to click on that enable and send, and that is going to send an email to the patient and give them a link to click on activate. And once they activate, then it's going to ask them for their date of birth and their last name, and then it's going to ask them to set a password. So they'll be able to set that password to what they want and what they can remember. Okay. All right, now let's go ahead and cancel out of here. Now, one other thing, I'm going to go back to my Rachel Ray patient. Let's say that my patient says, I don't have an email address for you to send something to. Is In that case, you don't have to be like, well, sorry, you can't use the patient portal. They can still use the patient portal. If you go into this edit patient data, we have an area here for the portal settings. So if you click on portal settings here, if you notice, my username's already here because I've already enabled the kiosk. But if they don't have an email address, you can actually set up their username and password right here and just give it to them versus sending them an email. You just have to set it yourself. And then if you notice, it says reset password upon next login. So let's say I set it as RRay and I put it as Encompass 1 as the password, let's say that, or EHR1, whatever whatever you put. Then if I say yes here, when they go and log in with those credentials, it's going to require them to change a password. But at least you can, still set it up for patients even if they don't have an email address to provide you, or if they don't know their email address. Now, I'm going to talk about in a few minutes, how do they log in? What URL are they using to go to the patient portal? You also have this patient representative portal section here. So let's say it was a minor and you wanted to send portal information to a representative like the parent or something. You can say yes here, put it in their first and last name, and create a username and password for them, and they would be able to log in as well. All right, so, and you can see right here, it says in order to qualify for meaningful use, the patient's portal must also be enabled in addition to their representative. So if you guys are qualifying for meaningful use, you can see it has to be enabled. In addition, the patient's portal has to be enabled in addition to the representative. All right, so that's two ways, that you can get this portal activated for the patient. And once you set up a username and password in this section, then it would say active up here. But of course, the easier way is just to click on the inactive and have that email and username there, just send the link, if that patient does have an email. All right, so now patient received the email, they activated it, and they went onto the portal. So let's talk about how do they get to the portal. So they will actually use your office's URL to get into the portal. Now you may be like, well, wait, they can log into in our office's URL. How does that even make sense? Are they going to have access to our other patients' information? No, they won't, because when the portal was set up and they're assigned a username and password, when they use your office's URL, they are just going to have access to the portal. They do not have access to anything else. So I'm going to go ahead and log out of here. I am still on my my office's URL, which is, educatortraining.eyefinityehr.com. So whatever your office URL is, that's what, the patient will be going to. So I'm going to go ahead and log in as Rachel Ray here. And you're going to see that when the patient logs in into the portal, it looks completely different than what EHR looks like when you're logging in as a staff member or a doctor. So here is the portal for your patients. This is exactly what they're going to see. So up at the top, you have several sections here: My Health, Appointments, Messages. So messages for that intramail if you are using that functionality, and then Test and Results. Now it does generally, it defaults to appointments here. So it'll automatically go to this appointments tab, and it goes to video visits. So if you see here on the left, video visits is first, and it says you currently have no active video visit. Now, if you had created a video visit that you were doing, one of those visit types, there would be an option for them to start it here, so they could join that video visit. Now, because my patient doesn't have any video visits, I want to go check and see, what does it look like in the upcoming appointments? Let me click on that. And you can see that Rachel Ray has an upcoming appointment tomorrow at 2 o'clock at the Surfside Optical location. So she's on my appointment calendar, and I said that I want her to be able to, see those appointments here on the portal, so we can see her, appointment there. And then past appointments, if she had been in previously, there's our past appointment. And this is where the patient has access to the visit note as long as you've allowed them to. And keep in mind that you want to have your visits final, because if it's not final, they will see it here, but they will only have access to the patient education part of the visit. They will not be able to see their entire visit. So I can tell this is final because of what we have over here, that they can download a CCDA, they can send messages, but if it's not final, the only thing they're going to see under actions is patient education. That's it. And then if they want to view this, they can just click on the date here, and you can see how it just opens up their final visit note here. So very easy for the patient to have access to this and see that documentation, from that visit, as long as you allow them to see it. And then they do have these little tabs here where they can go to patient education if they want to look and see what it says about myopia and what it says about the current medication that they're on. They can also view a handout like you guys can see in your office, because you can actually print this out for your patient when they're in the office, but they have access to all of that in here. Okay. All right, and then I can click on go back to visits to go back to the previous screen. If they had multiple visits here, then you can select that next visit note and open it up and look at it. All right, so next under here is eyewear prescriptions. So you can see my patient has multiple eyeglass prescriptions here, just in single vision, written by our test doctor. They can download and view them here. So if you wrote a contact lens prescription, an eyeglass prescription for them, and you have it set in those portal settings that you want them to see them, they'll see them here. They can download here and view them as a PDF, and they can print it out if they want to print it out, or maybe they just want to view it here, but they have access to it because probably you have printed it out for them in your office. But if they have access to the portal as well, they have access to it here as well. All right, so I'm going to close that out. And then results, if you had posted like any type of results or anything in here. These are like ask a question things, like maybe, they asked you a question and you answered. So, that's what this is for results. Okay, and you can see how it skipped over to the tab up here from the appointments when I clicked on that. All right, so that is the appointment section in the test and results area. Now I'm going to go to My Health. So My Health, you can see, has all these different sections here. You have your contact info. You can see, they have access to change certain things. If you notice, they cannot change their name. They can't put a driver's license number in. They can put a preferred name if they're like, oh yeah, I don't go by Rachel, I don't know, go by something different. Or maybe, the name is Michael and they go by Mike. They can put their preferred name in here. They can change their date of birth if it's not correct. You can see all these different white areas that they can, update in here. So, and then you see they cannot change their address. If their address is incorrect, if their email address is incorrect, then they will have to notify your office, to update that. They can add a seasonal address. They can add their employer's name here as well. So I'm gonna see. I'm just gonna update something here just to update it. So once they update something, they can just save and continue, or save and continue. It's going to take them to that next section, which is your insurance and pharmacy. So we can see this patient already has insurance documented. So it's documented in the practice management side of Encompass. So we can see that this patient has VSP, because maybe this was a prior patient. So we already have their insurance information. Now, if the patient called and scheduled an appointment, you may have added their insurance already, on their chart in Encompass practice management. And then also down here, if they had a pharmacy already added in, then it would list that pharmacy here. But you can see this patient doesn't have a pharmacy. Now, they can go here and add a pharmacy. Not sure if a patient will, understand the difference between these, but if somebody does and they're like, oh yeah, let me go ahead and look at my pharmacy, I can click on it and they can search for a pharmacy here. Maybe they go to, CVS, and then I can search. But whatever, they can look up by their zip code and things like that. And then they can actually add a pharmacy. So I'm just going to click on one. Yeah, I'm just going to add one, and they can just add the pharmacy here. And then I'm going to save and continue. Medications. It already shows that this patient is on Flomax. They may like, yep, I still take that, or maybe they're like, no, I don't take it. They can actually inactivate it, complete it. They can do those things. They can add things here if they want to add a new medication that they're taking, so they can, put that in here. Right, and then let's go to allergies. So my patient has no allergies according to their chart in EHR, because kind of they're looking at this info based on what you guys already have. If it was a brand new patient and the clipboard had not been documented yet, they can definitely say, oh, wait, yeah, this, we wouldn't have to unmark. It would just be open for us to put a allergy in. But if the patient's like, oh, yeah, now I have an allergy, yeah, the office didn't know the last time I saw them, I can click on unmark and look up allergies here. So if I'm allergic to bees, I'll just put that. And they're like, yep, I get hives. And they can save and continue. And then here's our past medical history. You can see none's already selected because the last time they were seen, there was nothing in their past medical history, and they may be like, yep, nothing still. Surgeries, they had a hysterectomy before. If nothing else is happening, then they'll just go to ocular history. And they're basically reviewing this and just updating as needed. So ocular history, maybe they're like, oh, you know what, now I wear glasses because I got a prescription last time I saw the doctor. Um, any surgeries? If not, then we can just save and continue. And then here is the social history section. So we want them to specify this. If it's not, they're like, yep, never a smoker. They, put in alcohol use, excuse me, exercise status, caffeine use. You have these different things. So I'm just gonna do the smoking status. Next is quality measures. You can see where do you have certain things. For patients 66 and older, have you received a pneumonia vaccination on or after your 60th birthday? If they want to answer this, yes or no, maybe, they're not 66. And our patient is, she's 69. So she may be like, nope, haven't gotten the pneumonia vaccination. There's advanced care options in here, if they want to answer those. And then family history. Right now, this patient has no family history, but what if they're like, oh God, yeah, my mom now has diabetes. So they can put this in here. Maybe they don't feel comfortable putting all this in here, but they definitely, definitely can. And yeah, sometimes these are a little bit, let's say they have type 2. There we go. And say my mother has that. So they don't have to do all these sections, but I'm just showing you what they can do in here. And then problem list, they're not going to do anything in that. And you can see where it says myopia of bilateral eyes, because that's what the doctor documented the last time they saw this patient. So that auto-populated here in the problem list. So anytime that you doctors are seeing a patient and you're documenting a diagnosis in a visit, and that visit is visible to the portal, then they, in this problem list, they're going to see any diagnoses that you've ever documented in their visits. And then lastly is my forms. So what my forms is if your practice has created any PDF forms for the patient to sign here in the portal. That info is also in the help menu. If you're like, what is PDF forms? How do I set those up? All of that is in the help menu as well under PDF forms. And you can actually set up forms just like if any of you guys use the kiosk, you can set up like consents and things like that for the patient to sign on the kiosk. Same thing here. They can, fill out those PDF forms. And then when they're done with making their updates in the portal, then you'll see all that info coming over to the EHR side. All right, and then lastly is our messages section here. So the messages section is when it's talking about the intramail. So if the patient has received any messages, they're going to see it in their inbox, if they've sent any. They will see ones they sent. They also can compose a message. So when they can compose a message, then they're looking for a group here, and I don't remember what that group was named now that I remember. But when you have your group set up, then there would normally be a list here of a person, a group, and the location that it's in that they can select. And then they would put a subject in here, put a message, and then they can send it. They can also add attachments. Is there anything they wanted to attach to send to your office? Then they can send this message via intramail. All right, so that is the all from the patient perspective, what they're seeing here on the portal, and the things that they can update, the things that they can see. So I'm going to go ahead and log out of Rachel Ray's portal, and Rachel Ray can come to her portal anytime she would like to and make any updates as needed, or look at any documentation, their prescriptions, any visit notes, anytime. So I'm going to log back into EHR. I'm going to talk about a couple other things here. So I'm going to go back to my Rachel Ray patient. And look at this box we got here. So anytime the patient makes any updates on the kiosk, on the portal, it functions the same way. A box will populate in the screen here whenever someone looks up the patient, and it's going to say, well, here's all the updates that this patient made. Now, you can cancel out of this box. Maybe somebody's like, nope, don't want to deal with that. The doctor's going to look at that. I'm going to cancel out of here. Now, I've canceled out of here. Now, if the doctor logs in and looks back up the patient, that box is going to pop up on the screen. But let's say that I didn't look back up this patient, that I was still on this screen. You can see right in the middle, it says this patient has updates that need to be reconciled. Drug warnings may be impacted. And I can go over here to the right and click on patient updates, and that brings that box right back up. So very easy. It's not like gone forever when somebody cancels out of it. You have access back to it until these are reconciled. So then I'm going to open up my info here. I can see she changed her language to English. I can accept all, reject all. When you do reject all, accept all, it's doing it for this section. So if there was multiple changes here, I can easily just do accept all versus doing it individually. So I'm going to accept all. And then that one's done. I'm going to go to ocular and say, okay, remove none. And now they put in there wearing glasses. I can accept all. Then social history, never a smoker. I can accept all. Now diabetes is in the family history, accept or accept all, either one, because either one will work. But you see, is when I did accept all, kind of like closed up that section and opened up the next one for me. And then quality measures, they answer no to this, so I can accept all. And everything has been accepted. So now I'm going to save this. And you're going to notice that message disappeared because now all of that information has been reconciled. And all of that has flowed into this patient clipboard. Wears glasses. Where is it? Smoking status, never. Bee pollen, diabetes. So you can see all of that flowed into the appropriate locations. All right, so the last thing here that I want to talk about, we saw that this patient, could see their visit note information on the portal. So if you look here on the right-hand side, here's my visit that's been done for this patient last time. And you can see over here to the right that I have statuses here. I have the option to hide from portal. So if there's ever any, visit that you're like, yep, don't want this to be shown on the portal, I can click on hide from portal, and you have to put a reason as to why you are hiding this from the portal. Why are you not giving the patient access to that? And you can see where it says patient request not to share in patient portal. Maybe they don't want all that to be in their portal. So you can, decide here, what's the reason why we're saying not to, not to show it on the portal. There's got to be a reason. It just doesn't let you say, okay, hide it for no, no good reason. And I'm just going to select that. You can put a note in here. I'm just going to put test for my example, and I'm going to save it. So now you can say hidden from portal, view details. But if I'm like, wait, no, now I want to show it. Maybe now I'm like, okay, yeah, we can show them now. I could just simply click on show in portal. I can view the details of what I put in as to why I hid it in the first place. But when I click on show in portal, then you previously selected a reason to hide the patient health information from the portal. Are you sure you want to now show this information in the patient portal? And I can say show in portal, and now you can see now hide from portal is there. Now it's shared to the patient again. So you have control of this. You have, as you guys saw in the firm admin, we have control of what we're showing to the patient, in some aspects. Here we have control of, do we want this particular visit to be visible in the portal? All right, so that is the patient portal experience. So, like I said, my name is Tina Sanchez. I hope you guys enjoy this webinar. And don't forget about our additional education resources as you see here on the screen. We have role-based training. We have training webinars, one-on-one virtual trainings, on-site training or consultation. And if you go to, eyefinity.com/education, you will see those particular things, those resources on our website. All right. Well, thank you for joining, and hope you have a good rest of your day.